This week's Info Blast is focused on depression. With around 1 in every 12 teenagers suffering with depression, it isn't a small issue. As always, we will be giving you the basics to understanding this complex mental health issue. Welcome to the Mental Echo. Depression is defined as a condition where a negative mood, loss of interest in activities and other symptoms affect everyday life and functioning for more than 2 weeks. This is a very broad definition, so let's begin with what we think of when we imagine depression. Many people use depressed as a description for the way they are feeling. This sometimes means they are depressed, but just having a bit of a down day isn't a clinical or treatable form of depression. Also, having only bad and negative thoughts doesn't constitute as depression. There are more physical and mental symptoms that we will address later. No one should suffer from depression, and it isn't a normal part of life. While yes, teenagers are moody and very often just hormonal, if the symptoms of depression last for longer, then considering a visit to the doctors is highly suggested. Having a bad mood is one thing, but depression is a whole other thing. If you're concerned that you or a loved one may be suffering from depression, you should look for these signs and symptoms: strange sleeping patterns, withdrawal from friends and family, difficulty concentrating, complaints of pain, difficulty making decisions, excessive and inappropriate guilt, irresponsible behaviour, over or under eating, memory loss, obsession over death, rebellious behaviour, sudden drop in school achievements, and feelings of sadness, anxiety and hopelessness.
So their family and friends know them really well, so they would probably be able to spot those early signs, really.
Another very serious part of depression is suicide. Depression is widely associated with suicidal thoughts and attempts. With 1 in 3 teens with depression attempting suicide, there is no wonder why depression is such a taboo subject. Luckily, very few succeed with suicide. However, we need the knowledge on the issue and help before a child reaches this point. There are 4 types of depression that children can suffer from. Each is slightly different. Major depression, or clinical depression, is serious. This type involves all of the aforementioned symptoms, and an episode lasts about 2 weeks. Often with this type of depression, sufferers don't care about their looks or cleanliness and will not have a consistent sleep pattern. Sometimes this can lead to suicidal thoughts. Next type is dysthymia. This is milder but no less important and often lasts longer. A teen will probably feel gloomy and down for most days, lasting around a year. Because the episodes are so long, it's hard to recognise anything out of the ordinary. 70% of teens suffering from dysthymia suffer from major depression at a later stage. Reactive depressions are the most common type in children and teenagers and usually don't last for very long at all. It is often triggered by an argument with friends, a letdown or a loss. The symptoms mainly encompass just feeling sluggish for anything from 2 hours to a couple of weeks and will lift on its own. Finally, there is manic depression. This is also known as bipolar disorder and often begins in teenage years. This type can be seen by a sufferer having 2 different states. At one point, they may be suffering from what seems like any other type of depression. This is the first symptom. Next, the sufferer will experience a period of mania. This includes having lots of energy, insomnia, speaking fast and loud, doing work quickly, and feeling like they have special powers. Treating any depression will not be a quick process, but it's worth it to improve a sufferer's life. If the depression is mild, children and teenagers often undergo psychotherapy. This helps with the symptoms. If the depression is more serious, then antidepressants may help. However, there is a serious risk of side effects. Having both the psychotherapy and the medication is safer and has a higher probability of working. 50% of depressed children recover within a year, however, may become depressed again. If any of the topics covered in this episode affect you, or if you want more information on depression, we will include a list of websites, books and leaflets you can refer to in the description, and your GP or school nurse can also answer your questions. Feel free to contact us with any queries or requests, which we can address in the following episodes at thementalecho@gmail.com. If you are suffering or know someone who is, remember, knowledge is the first step to understanding.